Dr. Julie Graham, who will take questions in a moment. I'd start with a general update this morning. Case numbers overnight fell to 866 cases, with once again more people being released from isolation than being diagnosed yesterday. Yesterday there were 1,009 people that were recovered and released from isolation, and 866 cases. We now have a total number of active cases of just below 6,000 at 5,984, and the total number of people who have recovered of over 17,083 people that have now been through isolation, been positive through isolation, have now recovered. There are 31 people in hospital with COVID, and of these 31 patients, 13 of these people in hospital with COVID are being treated specifically for COVID. Of these 13 patients being treated for COVID, 3 are being cared for in the ICU and 2 of these people are being ventilated. Yesterday we distributed 5,529 rapid antigen tests, including more than 1,300 that were couriered to people's homes and provided to them in either remote or regional areas, or those who couldn't get transport to go and collect them. The system's working well, with RATs being free and accessible to anyone that requires one who is symptomatic or a close contact under our rules. In terms of the Mersey Hospital, there is no change from what we reported yesterday at this stage, with a total of 9 patients and 2 staff members reporting positive, with the infectious control and outbreak management plans in place and working, and obviously the tracing continues as we work our way through that. Today, however, sadly, I do need to speak about our first death associated with COVID since 2020. The person deceased is a 90-year-old woman who was a resident at the Barrington Lodge nursing home in Newtown, Hobart, and our thoughts are obviously with her family and friends at this difficult time. I understand that she had a range of medical issues. She was diagnosed as part of the initial testing that took place across that facility, which was undertaken on Wednesday of this week, following an outbreak of COVID which was first identified in the facility on Monday the 17th of January. Now, her death was not recorded on the death certificate as being directly from COVID. I want to explain the circumstances. In the 24 hours prior to her death, although asymptomatic, she tested positive for COVID, and therefore COVID cannot be ruled out as a contributing factor to this death. And in the interest of transparency, we are reporting it. The Aged Care Emergency Operations Centre and Public Health have been supporting the facility with its outbreak management plan. The facility currently has 65 residents, and the number of cases today is 18 for residents, and 5 staff are positive. On behalf of the Tasmanian Government, once again, I do want to pass on my sincerest condolences to the family and loved ones of the woman who has sadly passed away. I do also want to thank the staff at the Barrington Lodge nursing home for their hard work under difficult circumstances. Now, these unfortunate circumstances are again a reminder that COVID is around, and we need to continue to be vigilant whilst we're going through this transition phase to living with COVID. The woman who died yesterday was not vaccinated, and once again I urge all Tasmanians who are eligible to please get vaccinated. Don't listen to the messages that are on social media. Please speak with your health professional and get vaccinated. If you're due for your booster, please get it. And if you're a parent or a carer and your child is eligible for a vaccination before going back to school, make an appointment. We have the capacity to ensure that 100% of our 5 to 11-year-olds can receive their first dose prior to going back for the school year. So please take that opportunity. Please don't forget the important COVID safety behaviours. Wash your hands, have good hygiene, cover your coughs and sneezes. Importantly, if you're unwell, stay home and get a test. I'll hand over to Julie Graham to take some questions as well. Thanks, Julie.
Good morning. Thanks, Premier. I'm happy to take any questions that you might have.
What did the woman die of then if it wasn't believed to be COVID?
She had a multiple number of comorbidities, and as the Premier has pointed out, COVID may not have been the direct cause of her death, but would have contributed or may have contributed to it. Certainly private medical details are not something that I'm going to disclose at this point in time.
Do you know how COVID entered the facility in the first place?
Certainly we know there is a widespread community transmission of COVID at the moment, circulating in a number of places. Our screening program in the facility of people being tested if they're symptomatic identified positive cases, and that implements our outbreak management plans within those facilities. And then we undergo what we call sweep testing to identify if there's any other cases within the facility, both in residents and in staff. And then we can follow that up and continue to maintain infection control within the facilities and good outbreak management planning.
Do we know if this woman was unvaccinated by choice or because she hadn't been given the opportunity?
Look, all our aged care facilities have had the opportunity to be vaccinated. I can't comment on an individual person, but all our aged care facilities have had the option of vaccination provision within them.
Can you just run us through the circumstances which led to her getting the test?
So in aged care facilities, when we identify a case within either a worker or a resident, an outbreak management coordination plan comes into play, and this involves testing all residents within the facility and staff to identify whether there is any other residents who may be positive or staff that may be positive. And this initial testing was part of one of those, as I said, what we call a sweep of testing.
Was it believed she got COVID from another patient or staff member?
Look, that's unknown at this point in time. As I said, we are investigating the outbreak within the facility and in providing advice around appropriate infection prevention and control measures to have in place so that we can prevent any further transmission within the facility.
And just more broadly, in terms of people who are ending up in hospital with COVID, is it more common amongst the unvaccinated people? Is that what you're seeing?
We certainly are seeing nationally and within Tasmania, both related to Delta and Omicron now, those who aren't vaccinated are, 6 to 10 times more prominent in our hospital admissions. So again, it is important that everyone gets out, gets their vaccine, gets their booster, and helps protect both themselves and the community.
Can I ask, was there a reason the woman wasn't transferred to a hospital?
She wasn't. She was asymptomatic. As part of it was picked up as part of a testing sweep, so there was no need to transfer her to a hospital.
Was that nursing home under lockdown at the time, and what's happening with that nursing home now?
So there is, as part of the outbreak management coordination, the nursing homes do go into, I don't like the word lockdown, but it is, we put restrictions in place of movements, of residents interacting with other residents and with staff. We increase appropriate PPE within the facilities and organise this testing, and we'll continue to work with the facility and organise ongoing testing until we are confident that there is no further cases within the aged care facility.
But safe to say for now no one's going in or out of that facility?
At this point in time, yeah.
Questions from Premier?
Premier, has the source of the transmission at the Mersey Hospital been identified yet?
Look, tracing's still underway. Look, we haven't arrived at the index cases yet, as I understand it, but that matter will continue to be looked into.
Do you have any update on the person at the Launceston General Hospital that was in ICU as well?
Look, we have 3 people within ICU and 2 are ventilated, and I have no further information in terms of an individual status.
Is there a sense of when transmission began occurring at the Mersey Hospital?
Look, Julie might be better placed to speak about that, but obviously it was picked up initially within an individual patient earlier this week, and then obviously testing has continued since then, but that's being worked through. I think we've spoken about that on a number of occasions. I'm not sure if there's much more that we can add.
It represents our contact tracing efforts within the hospital. So again, it's people having testing when they're symptomatic to identify cases that allows contact tracing and identification of any other cases that may have been in contact with the investigator. But investigation is ongoing.
And just on WA, do you have any reaction to the Premier announcing that he's looking at delaying the border reopening date?
Well, look, to be clear, that's a matter for the WA Premier, but to be honest, I think it's a failure of vaccination, to be honest. Where WA is today is where we were, broadly speaking, at the end of November, early December. They were at about 88%, I think, double vaccinated in terms of over 12s. So, I think you can point very clearly to that as being a major problem.
And in terms of their handling of COVID, do you think, the WA government is behind the eight ball, seeing as though everywhere else is, has opened previously?
Look, as I've said, the decisions that are made in WA are a matter for the WA Premier, but it's quite obvious that their vaccination rate is certainly much lower than what ours is. They're in a completely different set of circumstances than we are.
Are we going to be able to find out how many elective surgeries are able to be completed under the level 3 escalation plans in our hospitals?
We are reporting on a monthly basis in terms of elective surgeries, my understanding, so I'm certain that those numbers will be released as we move forward.
And just on Scott Gadd from the Royal Agricultural Society, he's calling for a round table with the government just to discuss future upcoming agricultural shows. He doesn't want to see any restrictions or any of those cancelled. Would you consider that round table?
Look, I'd say to Mr Gadd, and I want to be really clear on this, it surprises me that the CEO of an organisation like the Royal Hobart Show isn't able to discern the difference between a free-moving event with between 5,000 to 10,000 people at it as a show compared to a cricket match that has seated, ticketed, fully vaccinated access. And that's the point that Mr Gadd refuses to accept, that the operation of a show is completely different to a ticketed event. Now, we will continue to work with the shows right around the state, but Mr Gadd, to be frank, on this is refusing to accept the public health advice in terms of the difference between a free-moving agricultural show and a large ticketed event.
So do you think a round table is necessary? Is that something you would consider though?
Look, I'm not going to accept a round table from Mr Gadd. Like, at the end of the day, we'll rely on public health advice. We will work very closely with the Show Society and other show societies around the state. But to be clear, they are a completely different event to that which he has been pointing to in terms of a large ticketed sporting event. And I think Mr Gadd understands that. I think he's just more interested in the politics at the moment, to be frank. Now, look, just one thing I do want to finish with, and I do want to remind people that it is important that they do get their booster if it's due, that if they haven't had a vaccination yet, that they roll up their sleeve and they receive it. If they have doubts or concerns, that they speak to their medical practitioner and discuss those matters. And importantly, for their 5 to 11s, we have one capacity to provide every child in that age group with a first dose before they go back to school. And whilst it's not mandatory, I would strongly encourage parents to have that dose. It is the best protection. Now, as we've said continuously, the best defence that we've got is to be vaccinated. Some people will get sick, some people will get very sick, and unfortunately some people will die. The best way to protect yourself is to be vaccinated. And I would strongly urge Tasmanians to continue with the vaccination program. Thank you.